Okay, welcome to today's webinar, hosted by Engaged, the National Resource Center for Engaging Older Adults, in collaboration with the Diverse Elders Coalition. My name is Meredith Hanley. I serve as the Director of Community Capacity Building at US Aging, and I oversee the Engaged Resource Center. Our webinar today is called Social Engagement Among Asian American and Pacific Islander Older Adults, Successful Programs and Activities. According to the 2020 census, more than 20 million people in the United States identify as Asian, Native Hawaiian, or other Pacific Islander. And of that population, about 20% are over the age of 55. The Asian American and Pacific Islander population in the United States is incredibly diverse, with the Census Bureau including data on more than 20 different groups. While social isolation and loneliness among Asian American and Pacific Islander older adults is understudied, their diversity demonstrates the importance of developing culturally appropriate and tailored programs to support social connectedness of Asian and American and Pacific Islander older adults. And this is the topic that we'll be exploring on today's webinar. Next slide. We have a few housekeeping items. All attendees on this webinar are in listen-only mode for the duration of the webinar. So that does mean your microphone or phone will be muted as a participant, but there's still ways that you can engage with us today. You can submit questions at any time during the webinar by clicking on the Zoom Q&A or question and answer button at the bottom of your screen. And just type in your question and hit submit, and we'll take time to respond to some questions at the end of the webinar today, or near the end of the webinar today. There's also the chat feature. You can click on the chat button to introduce yourself if you like. You can also use the chat button to submit a message to us as the host. If you need technical support, we'll do our best to help you if you do need technical support. Also, the webinar will be recorded, and we'll plan to share a link with you in the next few days. Next slide. For those who may be using a screen reader and perhaps want to silence any unwanted chatter in the chat and Q&A boxes, you can activate the speech on demand feature by pressing insert spacebar and then pressing the letter S on the keyboard. Also, you can view closed caption subtitles and watch a live transcript of the meeting, or also adjust the size of subtitle text. To control closed captions, you can click on the captions button in the control bar at the bottom of your Zoom window. And if you'd like to notify us that you need technical assistance, you can either chat us, or you can also raise your virtual hand in Zoom. You can use the Zoom platform to raise or lower your hand, or press Alt+Y on your keyboard, and that should also raise your hand. And we'll do our best to help you. Next slide. I'll share a little bit more about my organization as we get started today. US Aging is the national association representing and supporting the network of area agencies on aging and advocating for the Title VI Native American aging programs. US Aging has a number of initiatives. They can all be found on our website, usaging.org, but initiatives that we administer, in addition to the Engaged Resource Center, which I'll speak on in a minute, are the Aging and Disability Business Institute. We also co-lead the National Aging and Disability Transportation Center alongside Easter Seals. We lead Dementia Friendly America. We also operate the Elder Care Locator and the Disability Information and Access Line, known as DIAL, along with many more efforts as well. So again, if you'd like more information on US Aging, you can check out our website at usaging.org. Next slide. The webinar today is convened by Engaged, the National Resource Center for Engaging Older Adults. US Aging, my organization, administers Engaged. Engaged is a national effort. It's funded by the Administration for Community Living through a cooperative agreement. And we work to increase the social engagement of older adults, people with disabilities, and their caregivers. Much of the work of Engaged focuses on identifying and disseminating information about emerging trends, developing resources, and also developing new tools and highlighting best practices as well. Our work is guided by a project advisory committee with representatives from 18 different organizations and resource centers, and they help to guide and shape our work and provide insights from their fields of expertise. as they do that, as they help to guide and shape our work. So again, Engaged also has a website, engagingolderadults.org, where more information on Engaged can be found. Next slide. So for today, we have one primary speaker. Unfortunately, two of our speakers have been unable to join us, but we did want to proceed with our webinar today. If they're not able, if the two additional speakers were not able to join us, we'll just send out links on their efforts after this webinar to make sure you get that information that way. But we are joined by Irene G Sansone, Executive Director with the Hanul Family Alliance. And Irene, we're very pleased to have you here today. And so with that, I will pass it to you for your remarks. Thank you.
Thank you, Meredith. I hope everyone can hear me okay. Good morning, everybody, or good afternoon. My name is Irene G Sansone. I'm the Executive Director of Hano Family Alliance. And I am an immigrant from South Korea, came to the US when I was 15 years old. And after getting my MSW degree, I came to Chicago to work for the organization that I'm still with today. So this year, I'm celebrating my 20th anniversary this year with the organization. And it's been 6 years since I became the executive director for the organization. If you go to the next slide, I will tell you a little bit about our agency, Hanul Family Alliance. We are a nonprofit social service organization that was founded in 1987 as Korean American Senior Center. We changed our organization's name in 2007 as Hanul Family Alliance to expand the scope of services to serve not only our seniors and not only Koreans, but everyone in their in our community, regardless of their age and their ethnic background. So today, the majority of our clients still are older adults, but we do serve people of all ages. And primarily, we work with limited English-speaking immigrants. And our agency operates from 3 different locations in the Metro Chicago area, one being in the city of Chicago that we began our operations 35 years ago. And then today we have 2 other suburban locations in the north suburbs, just to meet the changing demographic shifts of our community. Many of our immigrant communities have been moving toward the suburban areas in the Chicago area. If you go to the next slide, just to give you what the word Hano means. Hanul is actually a Korean word that means one large family. One large family. So our goal is to really become a organization that works with all populations, promoting healthy aging, family wellness, and community engagement. And our next slide actually tells you a little bit about how the organization was founded 35 years ago. And it is always interesting to talk about this because our founding board of director, Dr. Thomas Kim, was a physician, Korean American physician, who actually witnessed many Korean older adults back at that time, patients suffering from social isolation. And as of today, we are still talking about social isolation, and we are still trying to figure ways to get our seniors and older adults more engaged. And I see the vision continuing even as of today. And an interesting story that I would like to share with you all is that one of his older adult patients was actually found dead in his apartment. And it took days until someone discovered him in his apartment. And Dr. Kim at that time was already 71 years old when he founded the organization, Korean American Senior Center. But his vision and passion to help Korean older adults really lived on until today, and his spirits are still with us, I feel like, today. If you go to the next slide, it gives you the 4 core service areas of Hanul Family Alliance. The first program area is home care. This is a state-funded program called community care. We help our older adults stay home, and we help them age safe and healthy in their own community. And soon we will be soon launching our adult day services as part of this community care program branch. And then the next program area is healthy aging. This is where we do services from nutrition assistance, benefit assistance, prevention education for various victim awareness topics, and we do a lot of public benefit educations as well. And then the third program branch area is behavioral health. We have two bilingual counselors that are providing screening services, prevention education, support groups, individual family counseling, and so forth. And then lastly, our community engagement team really works with programs such as immigration, citizenship program, adult education, and Project Youth Connect. So all these programs exist for the purpose of for the purpose of keeping our community members engaged. You go to the next slide, it just gives you some photos of our programming highlights. So healthy aging, we do our nutrition service. We have been doing this for quite a bit now, almost over 2 decades. But over the pandemic, our dine-in service has really transitioned over to home delivered meal model a lot. And then a lot of our seniors, even today, are still feeling the reservation to come out to our centers and join our dining programs. So I'll talk about a little later how we tackle those situations. So even though we feel like the COVID is over, for many of our seniors still haven't come back fully back to our agency. Okay. And then if you go to the next slide, community care is what I described to you earlier. It's all about home care and adult daycare that will be launched. And we currently have 180 home caregivers, home care service aides who are bilingual and bicultural. And we are serving 400 seniors yearly. Going over to the next slide, behavioral health, as I have explained, we have two bilingual counselors. The stigma around getting mental health counseling and services is pretty high among Korean community, and I would say it's pretty high in the AAPI and the immigrant community. So we really try to connect with our community stakeholders through various community educations and church outreach. We want to package it as much. We want to package it in a way so that people don't feel like they are being stigmatized or named for seeking behavioral health service. If you go to the next slide, a few photos of our community engagement team. So our older adults getting their naturalized citizenship at the age of 70 or 80 is actually not something new. We have these older adults studying for their naturalization test all the time. And we have also ESL education, computer education, and many of these programs are now offered a hybrid, so both in person and over virtual setting. And I do want to, if you go to the next slide, I do want to speak a little bit about the social isolation among AAPI community members and LEP older adults community overall. And it's been many studies have suggested that higher risks for social isolation for immigrants and refugee older adults in general. And some of the unique factors, as many of you already know, right? The racism, discrimination, language barriers, weak social networks, separation from friends and family. COVID pandemic has played a huge role in this. And then Asian hate crime is something that we're aware of, and it's constantly increasing as well. And I would like to go to the next slide to also talk about a little bit about the Asian hate crime among Asian older adults. And as you see on the slide, the Federal Bureau of Investigation has documented a 77% increase of Asian hate crime cases from 2019 to 2020 against Asian populations, specifically living in the US. And then the link that you see on this webpage, the Stop AAPI Hate Coalition, received over 10,000 reports of hate incidents against Asian American and Pacific Islander persons from March 2020 to December 2021. And of those, close to 1,000 cases were targeting older adults and 60 and older adults that are 60 and older. And our agency's elder abuse program in the past couple of years has also received the highest number of cases of hate crime, such as seniors being stopped to enter a store to shop or being pushed in a public transportation, and many of them feeling not safe to be on the street. And these are all exacerbating the cases of social isolation. And if you go to the next slide, one more data set that I want to share with you is from an initiative called Change Insight. And Change Insight is actually the first national social determinants of health data platform for the nation's AAPI community. And it's powered by one of our sister organizations in the Chicago area, which is Chinese American Service League. Currently, 5 of the Asian AAPI organizations are part of the study. And we have conducted our initial surveys among our client population. And these came out to be our top 5 risk factors. And as you can already all imagine, English still is being number 1, the English barrier and the language limitation. And then second one is the social integration risk. So I think it again goes back to isolation, not fully integrated into the society here in the US. And then followed by those 2 factors is the stress implication. Our immigrants and our older adults are under a lot of stress, and that's why the importance of mental health support and services are being emphasized so much nowadays. And then living poverty comes the 4th, and then education, no more than high school education. Of course, these data sets are only from selected population, not representing the entire AAPI community in the Chicagoland, but these are numbers, these are data sets collected from our clients that were mostly Korean older adults and that are limited English speaking folks. So if you are interested in finding out more about some of the data on other Asian communities in Chicago area, please visit their website, as you see on the slide. So talking about how we can be more innovative to bring our seniors back in the community, to get them more engaged. And I really do believe collaboration is the key. The next slide, I have titled it as, if you go one more to the next slide, I have titled it as hybrid model programs. And as we were going through the COVID pandemic era, we were not able to have any of the seniors in person in our agency. So what do we do, right? That's where you collaborate with your funding agencies, with your volunteers and your staff, of course. And we were able to successfully transform many of our programs into hybrid setting. Of course, during the pandemic, they were all remote, but as soon as things were getting better, now we're able to host programs in both hybrid and in person, virtual and in person. So for instance, our ESL, our current senior ESL class is reaching more folks because now seniors can participate in our English program, even when they're out of state, when they're visiting their family members, or if they're not feeling well, they can still join us through Zoom class. But of course, we also have a group of seniors that are still wanting to come in and learn face-to-face from the instructor. So these were all made possible because of our funding agency was flexible enough to make this happen. And then many foundations also supported us to equip us to provide all these hybrid programs. And of course, in order to encourage more seniors to participate in this hybrid model, it was also important for us to continuously run tech literacy classes. So we are as of today, we're still teaching our seniors how to be on Zoom, how to use their mobile phones or their laptops or iPads to be connected. And even our counseling services are also provided virtually, which had never been done before COVID. And then some of the book clubs are running virtual. Many of the conferences and workshops do run hybrid today. So these actually hybrid models of programs have helped us engage more folks than ever before to get them engaged. And then the next slide, I have a few photos of our Memory Cafe, which was launched in right before COVID in March 2019. We are actually the very first and still as of today, the only Korean memory cafe in Illinois. For those folks who are not familiar with what Memory Cafe is, it's a program for caregivers and caregivers that take care of patients that have memory-related loss diseases or dementia or Alzheimer-related diseases. So we have them in our agency to provide support for both caregivers and for the patients. And of course, before pandemic, it was going great, but as soon as the pandemic hit, the program, we were not so successful at getting so many clients over virtual setting. But now we're back in person again in 2003. And this is a perfect example of creating programs that meet specific needs of our population. So because of these programs goal to work with the dementia families and Alzheimer caregivers and families, we are able to reach out to a new group of folks that had not been to our agency. So I would say we should constantly think about ways to really cater to these specific groups of folks that need very specific needs. All of our programs are becoming more customizable. They're becoming more sensitive to each different subset groups of our organization. And then the program slide or next slide shows a program called Active Choice. Again, our seniors are all about, exercising, line dancing. They love all kinds of classes and programs. Unfortunately, many of them were closed entirely during COVID, but we're really trying to get them back to our organization's programming, regular programming. And with the funding of Age Options, the area agency on aging in the Chicago Cook suburban area, we were able to relaunch it in 2023. And people are just coming in for all kinds of exercise groups, stretching, line dancing, walking clubs, which we hope to continue in the spring. So, these activities related programs do help our seniors come out of their bed. They can watch their phones and computers and laptops all day long, but they will never replace any of these social interactions and physical activities they get to do together at our agency. And then another way that I have tried to get more seniors out of their home was really bring back these cultural celebrations. The lady that you see on the left side of the picture, the one on the left side, she had never come out. She used to be a regular participant of our nutrition program, but during COVID, she was not able to come out, that much. She used to, she decided to get the meals delivered home. But, we have many seniors like that. But, we really tried for the first time last year in November, we said, let's do a big Thanksgiving celebration and let's bring on like cultural programming, like instrument groups, and then delicious food, of course, always the Korean, very homemade Korean food is prepared from our own kitchen. And then, throw in some freebies and, some raffles and maybe some stations for karaoke. So we made this really celebration type of thing. And then she was able to come out for the first time in 3 years, and she was so happy to see me. I was so happy to see see her. And I am like, that's when I was determined that we got to have these regular cultural celebrations. And of course, we do our Korean New Year celebration. We just did our Korean New Year celebration in February this year. We have our own Korean Thanksgiving celebration in September. So I think really the best way to bring our seniors really to promote these cultural celebrations so that they also connect back to their cultural heritage and identification so that they are more motivated to come out. And the picture on the left side or the right side of the slide that you're seeing is Lunar New Year, a photo from our Lunar New Year's event. And we actually had a kimbap making demonstration station. And you actually see the lady in the middle. She was able to bring her entire family members. And I thought, what a great moment. What a wonderful thing for her to be able to bring whole family member to experience the cultural, activities together. So, we have to continuously think about ways to bring not only the older adults, but let's think about ways to bring the entire family together at our agency. And then lastly, I would say we have to constantly think about ways to connect with our folks, with our senior, our older adults, and our immigrant population. You think, our seniors are always, best on their phone, but not anymore, right? Many of our Korean seniors are on their phones watching YouTubes, and they're also connecting super actively through a chat platform called Kakao. So that's a famous chat group for all the Koreans. So the ways of communicating is changing, and we have to adapt to that. So today we're not only communicating through in-person telephone, of course we'll continue to do so, but email, text messaging, and also we're putting more efforts to connect with their family members. The family members can also encourage them to be back out of their home and get more involved with organizations like us. And then local media, as many of you in this room might already know, ethnic seniors and ethnic immigrant population, they do rely heavily on their local ethnic media outlets. I would say a Korean immigrant might wake up in the morning and the first thing they open up is a Korean newspaper instead of mainstream newspaper. So that's how they usually get their information up to date on what's going on around the world. So I think it's important for us to be constantly working with this local media to get our information out there, and then also constantly trying to be at different outreach events, which we hadn't been able to do for a long time during the COVID, but now we're more than ever, meeting people outside, making sure our information and our resources are accessible to all kinds of people in the community. So I would say, if you go to the next slide, continue to be creative, and share your ideas with your funders, donors, partners, volunteers. They will be your key, right, to success, to be creative and innovative. And then know your constituents is something that heavily focused. That's why we are invested in survey projects like the Change Insight. We want to know what the needs are, what the changing needs are for our community members, and we also want to know how to better reach them. Right. And then let's keep encouraging them. Our seniors have been lonely. They've been in their own home for too long. And maybe they have gotten used to it now. So they think there's nothing wrong. But we all know the importance of keeping them engaged and socially active. So let's keep encouraging for our seniors so they could come back to our wonderful services. And that's all for me. And the next slide shows you my contact information. So if anyone has any questions, feel free to reach me. Thank you so much. And I'll hand it over to Meredith.
Great. Thank you. Thank you. That was such a good presentation. As I kind of mentioned in the beginning of the webinar, we had expected to be joined by 2 additional speakers, representatives from the Ektaa Center South Asian Senior Association, and a representative with the Pacific Islander Community Association of Washington. Unfortunately, they both kind of separately, but had conflicts at the last minute that prevent their attendance today. So Ali, I'll invite you to go through the next couple slides. And you can bring us to the Engaged Resource Center slides. As I mentioned earlier, we will share links to their work after this webinar, so you can get a sense for what they would have offered, and we'll do a blog recap of this webinar as well, and we can do a kind of brief snippet of their programs in that blog as well, since unfortunately we won't hear their live remarks today. But I'll share a few resources from Engaged, and then we will proceed into a Q&A session with Irene. So if you haven't already, and if you do have any questions you'd like to ask of Irene, feel free to go ahead and pop that in the Q&A box. But first, I'll share a few resources. So first, we have from Engaged, our most recent publication, in fact, was one that we put together with a partner of Engaged, Older Adults Technology Services, also known as OATS. That resource is titled Implementing Hybrid Programs, Considerations and Best Practices for Aging Network Organizations. And so Irene had mentioned hybrid offerings at her agency. And we're seeing a lot of agencies continue with hybrid programming still. So I think that resource is pertinent. You may find it helpful. It has a lot of helpful tips and best practices, whether you're starting up a new hybrid program or perhaps looking to kind of sustain an existing one and enhance it in parts perhaps. We also have an updated Engaged Community Awareness Toolkit that's been recently updated and relaunched with new materials. So that toolkit contains customizable materials such as a consumer brochure, infographics, fact sheets, PowerPoint presentation, sample newsletter language, sample social media language, and more. So you may wish to check that out. We also have an array of other resources at the Engaged Resource Center. We have a Social Engagement Innovations Hub, and that's basically an online clearinghouse of social engagement programs with the purpose of offering ideas for replicable programs. So if you are at an agency and perhaps looking to expand your programming, or maybe you have a program in place and would like to contact a colleague in a different part of the country who's maybe doing a similar program, and perhaps you're looking to brainstorm with somebody who has that same type of experience, the hub is a great resource for that. We also have an array of other resources, videos, other consumer brochures, monthly newsletter and blog, and much more. So next slide. I also wanted to share briefly about an initiative called Commit to Connect that US Aging is involved with. Commit to Connect is a campaign developed by the Administration for Community Living to address social isolation and loneliness. US Aging serves as the coordinating center for this initiative. The aim of Commit to Connect is to connect people who are experiencing social isolation or loneliness with programs and resources to build the social connections that they need to thrive. And so there are a wide array of activities as part of the Commit to Connect initiative. First, there is a nationwide network of champions, which is a no-cost network that folks can join. People join and then they're connected with an online platform, an online networking platform where they have opportunities to connect through online discussion threads. We also have specific events geared for the nationwide network of champions, as well as just connecting with your peers in the nationwide network of champions. So we encourage you to check out the committoconnect.org website, where you can find more information on Commit to Connect and perhaps get connected if you wish with that nationwide network of champions. And it's a really straightforward and, again, no cost sign up process. You can go to the next slide. One additional thing that I wanted to share about Commit to Connect is what's called a community of practice. We have a community of practice coming up. The application is open now. It's on understanding the impact of social isolation and loneliness programs. And that community of practice will bring together a cohort, a small cohort of agencies or network organizations that are already delivering a program or intervention aimed at addressing social isolation and loneliness. And those members of the community of practice will use the USERS tool to collect data and better understand their program's impact on addressing isolation or loneliness. And in fact, there is an information session later today. So if this sounds like an opportunity that you may be interested in, if you have a half hour to carve out from your day at 2 p.m. Eastern time, there will be more information on that opportunity and what it's all about, application process as well, more information on the specific users tool too. The application deadline for that is March 29th. So coming up in the next couple of weeks. Next slide. We also, and this is a joint activity between Engaged and Commit to Connect, we'll be holding a social engagement virtual summit next month. That'll be on May 9th and 10th in the afternoons, those days, 1 to 4 p.m. Eastern time, so afternoons at least on the East Coast. We'll be highlighting research, innovative programs, tools, and resources for the aging and disability networks, all around the theme of promoting social engagement. And the summit will have a particular emphasis on supporting those in rural areas, as well as supporting unpaid caregivers. And more information on the summit can be found on the Engaged website. The next slide. So now we have a few minutes for Q&A. So Irene, I'll invite you to turn on your camera, and you can come off mute if you like as well. I do see a couple questions coming into the chat box, so that's great. And feel free to keep them coming for those on the line. I'll start with the first question I see here in the inbox, which is, do you have any recommendations for outreach to perhaps a newer immigrant community? This person added a Nepalese population that has only come in the last 20 years, would kind of be the example they had in mind as they were thinking of that question. Any tips on outreach to that population, those that are newer in the immigrant community?
Sure. I think whether it's a new community or a community that's been around for a long time, I think creating a cultural connection will be the first approach for any organization or any administrator to try to build that relationship together. So how do you do that? I mean, it'll be super easy if you could have like a liaison type of folks from the community who can really be the face of, right, the community, Nepalese, for instance, in this case, Nepalese community, who can really translate back and forth, not only the materials and resources, but sometimes even translating the cultures of it, right? Explaining how do, the programs that are offered may not be so attractive if they find out there aren't anyone folks participating, people like them, right? So I think it's really important to find the core leader group from the immigrant group to get them involved as a volunteer or as a CSEP, I don't know, older worker, or even as a part-time staff to get the initiation going will be very, very critical for me.
Thank you. A couple other questions have come in as well. Another person asked if the Hanul Senior Center or Hanul Family Alliance provides any programming in language, in Korean.
Oh, we currently do not provide Korean language class. I don't know if the question means Korean language
Korean language
or...
classes, or like say the Memory Cafe or other programs, book clubs, are those events offered in English only or offered in Korean, or perhaps both? Okay.
Yes, most of our programs are all provided in Korean because our primary service clientele are Korean speaking older adults or their caregivers. But we are adding English classes sometimes for those like the children of the older folks who were born in the States are seeking information in English sometimes. So we do have it in Korean and English for the most part.
Okay, great. Thank you. Let's see, I see another question. Have you seen any successful ways that largely white community centers have welcomed people from communities of color, specifically in this person's case, Hmong elders?
Yeah, so here in the Chicago area, I've seen some mainstream organizations that have successfully done their partnering with the ethnic community members. And again, you do that not by inventing the wheels. You don't need to create the wheels when it's already there. So look for organizations that work closely with the community, and then try to see what you could offer. What's the gap? What are the services that you could provide? And probably it's the best idea for you to, again, connect with this local organization or whoever from the community, or work with the religious institution where the folks are already familiar with, and then go from there to build a continued relationship. And think about going out to them first. Instead of asking them to come to us, to your organization, think about going out to their religious institution one day, or going out to their community events. Things like that would be super helpful.
Yeah, that makes a lot of sense. Another question was just kind of, I guess, highlighting some of you shared a lot of really interesting programs that Hanul Family Alliance does. Are there any that tend to rise to the top in terms of being the most popular or the best attended?
So as of right now, of course, our meal programs are always very, very popular. I think I didn't emphasize enough how important the food is when we try to reach out to our ethnic population. Food always glues everyone together, especially, right? So home cooking type of, the food that they used to eat back in their country will bring their, they'll genuinely open up their hearts, right? And then with the food program, nutrition services, the active choice programs that I showed you, the line dancing, the stretching program, all those activities are very popular. So, go for them if you wanna.
Yeah, they sound fun. Let me ask maybe just one or two more questions. So if sometimes this type of question is hard to answer, but if you could share just one tip, and you've shared lots of great tips, so you might be reiterating one you've already shared, that would be fine. But just one tip for others who are wishing to implement perhaps similar social engagement programming, perhaps with the AAPI population more broadly, or with the Korean older adult population more specifically. If you could give them just one overarching tip, or maybe it's one really specific tip, what would that be?
To specifically reach out to the Korean community.
Yeah.
I think that was the question, right?
Yeah.
So so our population, again, tends to be open. They will open up better if they find somebody they already recognize or they're familiar with working with. So find that leader person again, whether a volunteer, whether a board member, whether a part-time, whether a translator. That person will play a critical role to build that initial building. And then once that initial partnership is built, listen to the population, see what they want to do, and whether it's an English class they're interested in learning, or whether it's an active choice, like activity programs they want to do, or is it that they want to share the Korean meals together and socialize. And you go from there and kind of do a small mini assessment with the group, and then you start doing one by one. And then once the word of mouth hits, you'll have, in no time, you'll be seeing folks bringing other folks to the program because, of the program's quality and all that. And then, if you are really want to be a little more aggressive, try to reach out to your local Korean ethnic media channels, whether it's a radio, TV stations, or newspaper company. I know here in Chicago, we have at least 10 different sources that we go after. So look for those opportunities. And then sometimes in social media now setting, also try to connect with different social media groups that are in your local area, but that has a lot of interest from the Korean folks or community members. So that way you could connect and find that seed person. Yeah.
Those are great ideas. Thank you. One additional question popped up in the Q&A box, so I'll pose this one as well. What type of policy changes are needed to better support older immigrant communities? Do you have any thoughts on that?
Well, every year we go to Springfield to advocate for the line item for the immigration, right? So that service includes interpretation, translation, English support, education, and also supporting bilingual caregivers and all kinds of programs to be done in multilingual services. So we actually need to, bring on our legislatures on board to keep supporting and keep increasing that budget, so that organizations like us or whoever is interested in doing multilingual or multicultural services are actually funded. I think that's really important. We cannot always rely on our volunteers or somebody just to do it because we are of that ethnic background, right? We just have to find that funding source to keep it going and to keep it more structured and to keep it more professional and more trained and everything. So it's absolutely important to keep the funding going. And then again, recently, when you hear more about, Asian hate crimes and safety issues, we also are very terrified that the gunshot happened in California area during the Lunar New Year. We just gotta keep in mind, we're all in it together. We cannot no longer separate ethnic community from the mainstream or this community from that. We should be all in it together and then try to advocate for the safety for all the issues together through collaborative efforts. So.
Thank you. That was really, really great. So I think we will end there with Q&A. I don't see any other questions coming up in the Q&A box. So Ali, I'll invite you to pull up the final couple slides here. So thank you to Irene for sharing her time, her expertise, and insights with all of us. Really, really appreciate that. Those were very informative remarks, Irene. There will be a survey that's displayed in your browser after this Zoom closes. So if you can take a brief moment to do that, I promise it's quite short. We'd really appreciate any feedback you have. In addition, we do a brief 3-month touch point survey after these webinars, where we look at the longer term impact of the webinars. So you'll see a similar type of survey come to your inboxes in 3 months. And if you're able to complete that brief survey at that time, we'd really appreciate that as well. The recording of today's webinar will be on our website at engagingolderadults.org, along with a copy of the slides as well. Next slide. And then finally, thanks to all the attendees who are able to join us today as well. We appreciate you spending a slice of your time, slice of your day with us. And this is just our final contact information. And engagingolderadults.org is our website. And if you get there, you can find a link to our Facebook, Twitter, and to our inbox. But if you Google Engaging Older Adults, you will find us. So I wish you all a great day and have a great rest of your week as well. Take care, everybody.